Hi everyone, welcome to my YouTube channel. I am Amy the Eye Doctor, and today I'll be talking about an important eye disease. I'll be talking about glaucoma. Glaucoma has a burden, a prevalence of about 3.5% in people between the ages of 40 and 80 years. So yes, glaucoma is a big deal, and today in my video I'm going to be breaking it down like ABC of glaucoma. In subsequent videos, I'll talk about tips to maintaining healthy eyes. I'll talk about what causes glaucoma. I'll talk about tips or things to do to prevent vision loss from glaucoma. So make sure you stay tuned to this channel, like, share, and subscribe. Thank you. Now to the ABC of glaucoma. Just the way our skin produces sweat, our eyes produce a fluid. This fluid is called aqueous humor. And what happens here is, as the eye is producing it, there's a drainage angle in the eye that ensures it is excreted. So there is a balance between production and excretion. And it is this balance that maintains our eye pressure. We call this intraocular pressure. And it maintains it at a normal pressure of 10 to 21 millimeter of mercury. So yes, we need our drainage angle to function so that as our eyes produce aqueous humor, this angle can drain it. Sometimes this drainage angle gets clogged, it can get damaged. When it gets clogged, the fluid that normally drains out of this drainage angle then accumulates. There's fluid buildup. As the fluid builds up, the eye pressure rises. A rise in the eye pressure will then damage our optic nerve. So our optic nerve is the nerve that carries information from our eyes to our brain. It transmits information. It enables you to look at a piece of artwork, delineate its details. It transmits the information from your eyes to your brain. It's made up of several layers of nerve fibers. And as the eye pressure builds up, it begins to damage these nerve fibers layer by layer. And then in glaucoma, the side vision begins to go first. So there's peripheral vision loss. Vision loss starts from the side. And this vision loss is usually painless, usually gradual, up until it hits the central vision. And then the individual goes blind. So glaucoma is a silent tip of sight. It starts out no warning, no early symptoms. As the pressure builds up, damages this optic nerve, vision loss starts from the side up until it gets to the center. And so as it's starting from the side, that's why we have the tunneling of vision. So all around you have dark spots, blind spots, and then you just have this little tiny spot in the center. So yes, it is a silent tip of sight, no warning, early stage, no symptoms. And the type of glaucoma I just described, where the drainage angle gets clogged, fluid isn't draining as normally as it should drain, is what we call open angle glaucoma. There's another type that we call angle closure. And what happens here is that we have a colored part of our eye, the iris. Sometimes it's so close to the drainage angle and it just slips over this angle, it covers it. So the angle isn't even draining fluid at all. Sometimes the coverage happens over a long period and we call it chronic angle closure. However, sometimes closure just happens immediately and there's a sudden attack, fluid builds up immediately, eye pressure spikes, damage to the optic nerve, and then serious symptoms. The individual can even go blind. It is an eye emergency. And symptoms you can see from this would include blurry vision, severe eye pain, headache. In fact, you could get sick in the stomach, nausea, vomiting, and of course, blindness if not immediately managed. Another thing that could happen during an attack of angle closure of glaucoma would be an individual seeing like rings, colored rings, halos, like rainbow colored lights. So yes, we can have open angle glaucoma where the drainage angle is just clogged, fluid is still getting excreted, just not in its normal quantity. And then we could have angle closure glaucoma where the angle is totally clogged, there's an eye pressure spike. There's also normal tension glaucoma. What happens here is the pressure is normal. So the pressure in the eyes are still within 10 to 21 millimeter of mercury. However, even at those normal pressures, these individuals have optic nerves that are still sensitive to damage. So I'm seeing a patient with an eye pressure of 15. However, there's evidence of optic nerve damage and other signs of glaucoma. And so we term this normal tension glaucoma because the pressure is still normal, but the individual is already having glaucoma. So who is at risk for having glaucoma? Let's discuss the risk factors. Who are the people prone to developing optic nerve damage and other things that will subsequently give them a diagnosis of glaucoma? Glaucoma damage is usually reversible. There's nothing we can do about it. However, early detection. So we see a patient who presented early, vision loss hasn't started out, seeing signs of glaucoma. There are several things that can be done to prevent progression of this disease. So yes, the disease can be managed. However, it still causes irreversible blindness if not quickly detected. So who are the individuals at risk for having glaucoma? People with high eye pressure. I already mentioned that once the intraocular pressure rises above 21 mm of mercury, normal is 10 to 21. Once there's a buildup of fluid, the eye pressure spikes. This is a risk factor for developing glaucoma. Another risk factor will be being short-sighted. Yes. By short-sighted people, being myopic is a risk factor for glaucoma. Also, being black, like I am. Yeah, so Hispanics, Asians, and Africans, being of that ethnic origin, is already a risk factor for glaucoma. Another risk factor will be this clear part of our eye that we call the cornea. Some people have thin corneas, and having a thin cornea is also a risk factor for glaucoma. Other risk factors will be having a family history of glaucoma. So glaucoma has a lot of genetic components, and once there's family history of blindness, family history of glaucoma, it puts you at risk, or you're prone to developing glaucoma. Other risk factors will be eye injuries, chronic use of steroids. Yes, steroids can lead to glaucoma. Also, diseases like diabetes, hypertension, having vascular disorders, having migraines also puts one at risk for having glaucoma. I'll delve into details, nitty-gritties later, but remember, glaucoma is a silent thief of sight, and to detect glaucoma, you need to have an eye examination done. So book the appointment today, and let's fight this irreversible cause of blindness. Thank you. Don't forget to subscribe. See you later.